An international human rights group wants the Nigerian government to ban the act of chaining persons with mental health issues. Human Rights Watch also wants the government to probe mental health centers, condemning the terrible abuse faced by thousands of people. The Director General of Christ Against Drug Abuse Ministry, Dr. Dokun Adedeji, joins me now to discuss this issue. Many thanks to you, Dokun Adedeji, for joining us on this hour.
Thank you very much.
There is a call for government to ban these centers, but while a lot of people attribute this to, or this kind of centers to, maybe, failure to regulate them, what about the parents? Are they not culpable here?
Yes, everyone is culpable. You see, it beats me when everybody says government should ban, government should ban. How did they set up? How did they start? Who takes the kids, the people there, and under what condition? The thing is, for me, it's like a red herring. The important thing is, do we have a mental health regulation? How do we deal with people with mental health? If we run away from that, it will be just, those people are doing that because there's an absence. And so the important thing is, yes, I do understand that there must be regulation of centers, but registration as well. And when you register, and does anybody check after registration how many centers are in this country? Who knows them? Have they been visited? What are the conditions? What are the standards of setting up and management of those centers? And also the families that bring those. You see, many times that families bring people, they like to run away from responsibility. They don't want to take responsibility for someone, then they keep them somewhere.
They don't want to have to be the one to deal with it.
Absolutely. And because they are ashamed. And it's a condition just like having hypertension or something. Somebody has a mental health issue. It can be treated. Most of them are treatable. And the fact that somebody has a mental health does not mean he can function as a normal person. Only there's limitations of things they can do. So until we come to those kind of realization, we'll be treating them as second class, and then people we can abandon somewhere.
Most of the parents who took their children there have said, look, they took their children there willingly, which means that some of these issues will continue. Now, if we're going to have parents taking their children there, what should government be doing in terms of regulation and registration of these centers? You
see, let's start from the beginning. What are the mental issues? How do we deal with mental issues? And then you have centers who can manage them. Are they professional? Are they people that can manage? Let's say there is even a center where they do rehabilitation. There must be a basis for setting up a rehabilitation center. There must be a standard of registration. And when they're registered, somebody must be regulated and checking what is happening. But again, the thing to think about is, no matter the center, no matter the state, should anybody be chained? Those are the kind of things we should begin to look at. Even if a family brings and then somebody is put there because it has an issue, must they be chained? No, they don't have to be. But again, those people chain them because they don't want to take responsibility. They don't want them walking around. They don't want them doing anything. So they say the only way to immobilize them is to chain them, which is inhuman.
They say it's character reformation and not necessarily mental health. Nobody wants to call it mental health issue. They say it's character reformation, but there is a vacuum right now between instilling discipline on mental health issues and those who can do this rehabilitation. So how should that vacuum be filled, which is a big question here? The
question, again, I would say is, where is the understanding of what the issues are? The thing is, do we have a mental health regulation or rules and then the classification?
Or even the bill?
Yeah, I mean, I think they've been talking about the bill for a long time. I'm not sure that it's been passed now. If it's there, what are the characteristics of the bill? What is it supposed to take care of? And then if those centers need to be there, I mean, if anybody wants to treat a mental health issue, it has to be in a hospital. I mean, where there are professionals to deal with it. But what usually happens is people cannot manage it, they can't pay for it, and also they don't want to be associated with those kind of things, so they go and dump them somewhere where they say, oh, it happens everywhere. When people think it's just located inside, it's not true. Across this country, if we check clearly, there's hardly a state that will not have a center like that. And until we come to an understanding of how do we treat a Nigerian, how do we treat somebody who is ill, how do we treat somebody who does not have capacity to take care of himself?
All right. The Director of Christ Against Drug Abuse Ministry, Dr. Dokun Adedeji, many thanks for joining us.